I think that the idea of renewing practice or renewing knowledge and creating innovations really requires a creative response to the conditions when they're not going well. And I want to make that point really explicitly, that it's when social policies are not doing what we intended them to do, then we need to think, well, what's possible to do in this situation? Given the same resources, what's possible to do that could be very different? We are spending several $100 billion a year for asset accumulation, and it's going from the whole population to the top. By any reasoning, this is bad public policy. There's no possible way to justify a government that is taking resources from the whole population and shifting them toward the top. $6 or $7 per older adult compared to per child is spent in the federal budget. So we're making large investments in the older population now, and we make really terrible, pitiful investments in our children. So this is probably not a good way to run the country. We should start everybody with an account, and we should use public policy to build those accounts so that all people over time are able to accumulate assets that they can invest in their future, for their education, perhaps in career training, perhaps in a home, and eventually it could help support their retirement security. We've been testing universal accounts at birth for children in the United States and actually in some other countries as well. And we've run an experiment in Oklahoma since about 2005, giving newborn babies an account at birth and with a treatment and control group. This is a very long project. It's taken us a long time to gather this evidence, but we have very promising results from these kids. These kids are doing better. Their mothers have a better outlook for their education. Their mothers have a little bit improved mental health. The kids have better social emotional development. We have very good evidence about this now. And during the past year, we've had 3 states, Maine and Nevada and Rhode Island, and working now also in Vermont and Illinois and a couple other states. We've had 3 states that have enacted universal accounts for children at birth. So and really as a direct result of having some evidence that this can be successful. The point here is that you should not, even though times are difficult, and times always seem difficult, and there are more resources available in this economy and in the world that you live in than there ever have been before, but we have to figure out how to reallocate resources so they benefit the populations that we care about, whatever those populations are. The sociality of humans is so fundamental. We are so social, and we don't recognize that enough, and we have the social skills to create institutions that can make everyone's life easier and better, and we often do that, and we will continue to do that. So part of our job is to be thinking, well, how can we continue to do that in other spheres? So that's a kind of big idea, but I really think that's the enterprise that we're all engaged in. So little by little, it's hard to see in our day-to-day work that we make progress in this, but we do make progress. And I think that we will continue to make that progress. So part of our job is to nudge that forward. Thank you very much.